Hi, this is application is called Crowd Wisdom. It's a caregiver agent for people with cancer. Here's an example of a patient. Her name's Michelle. She's got HLRCC, which is a type of kidney cancer. But we're going to be working with another guy, and that's me. And I've got a renal cell carcinoma with meningioma, and the type of neoplasm I have is called papillary RCC. So one of the things I want to do is look at some clinical trials that are available for me. I can go on and pick in particular papillary. I'm interested in phase 3 trials, and I want to go on and look inside the United States for my trials. I live in California, so I'm interested in that. And I could go on and pick trials via zip code, but I happen to go on and have UCSF very close to me, so I'm going to go on and pick UCSF. Mount Zion is a good one, and in fact, one of the trials are listed here. Let's go on and take a look at it. This was for my cancer as of 2014, and the trial itself uses everolimus. The trial itself is called Everest, and it's everolimus in treating patients with kidney cancer who've undergone surgery. So now that I've gone over and figured out the kind of stuff I've got, I can go on and enter in a question, but I've done it before, and I'd like to go on and ask if I should go on and participate in the Everest trial. And this is a description. It talks about the NCT 00102049 page that I just saw. I entered that manually inside this thing, and I can submit the question to the agents. The agents, in fact, that I've picked for this thing, they include guys like David Brown, Lawrence Albergese, Brad McGregor. Nazar Tanier, in particular, is one I wound up submitting this thing to. And I want to submit this question to that agent. And now that that's happened, I've gotten a set of opinions back from these guys. And this in particular, I've looked at the stuff for Michelle, but I'm interested in stuff for me. And that is, should I participate in the Everest clinical trial? And it turns out Nazar Tanier wound up giving this particular opinion, but there are other opinions that come in that are directly that are different from this. And basically, my primary physician, Jeff Brown, said, no, go ahead and do it. There's a minimal downside. So I've got a yes and I've got a no. So it turns out it's really important to go on for these particular questions, to go on and find out how I should go on and moderate it. Who should I go on and pick? And at this point, I've gone over return the strongest answer. This is done with a LLM internally, and it goes on and says, from all the different patients that I've asked, there was an ID of a guy from Sutter, from Stanford, from Davis, from Los Altos. And these 3 guys said yes, and these 2 guys said no. And if I go on and look at the answer, I had this particular answer looked at by moderator 4. Moderator 4 is an LLM that says return the strongest answer. It compared pairwise all the answers and recommendations that I got from all these different guys. And here I've got the answer that I'd like, and it's this one. Now, it turns out there's different kinds of moderators based on different kinds of questions. Let's look at some of the other questions that I've asked. I've asked in particular for what are the tumor's genes of interest? And I had a hackathon where a lot of people looked at my RNA-seq, wound up finding genes that were important, and I had these particular moderators. Has anyone else recommended this gene? Have any non-experts recommended this gene? And what is the RNA-seq expression level of this choice? If I go on and look at all the things that came back, here are the genes that were picked. Moderator 1, moderator 2, moderator 3, and moderator 1, 2, and 3 are all the ones I've got. Remember, moderator 1 went on and said, has anybody else picked this choice? And the answer is no. So that might be something I'm interested in. But here, these 2 teams said BARD1 was a gene of interest. But I wound up asking in particular as well, what is the RNA-seq value of the genes that were selected? This was not known to the people that participated in the hackathon. And it turns out biomarkers.ai wound up saying I ought to look at FHL1 gene and at KING1 gene because of the fact that they were the least and most expressed genes that I had. So if I'm looking at moderator 1 and answers for the stuff that I've got here, Moderator 1 suggests that I look at BARD 1 and set D2. Moderator 2 says I look at BARD 1. Moderator 3, which says who had the highest RNA-seq value and lowest, suggests look at genes KING1 and FHL1. And all of these particular members of my tumor board were unaware of the answers that the others gave. And according to wisdom of crowds, that's a pretty good approach. Thank you.